The main concern is that the virus could cripple the healthcare system.
We'd worry for our patients.
It's really hard.
We'd worry for our families.
The governor is saying that we could hit capacity in less than a week.
And we'd worry for ourselves.
People who are just incredibly sick.
Health systems are being pushed to the brink.
We're concerned, we're scared.
They were at war before they even knew the enemy was in the room.
I started to suspect we had COVID patients in the beginning of March. And I had a patient that was admitted for flu-like symptoms after a cruise where about 10 of their friends got sick as well. But they admitted her for flu, but she didn't have the flu, and they put her on Tamiflu and sent her home. But sure enough, she came back a week later and was admitted for the double pneumonia. And I had been exposed, to her.
Amy Devine was already a registered nurse, but she had just graduated from nurse practitioner school, more advanced training, when the pandemic surfaced at the major Metro New Orleans area hospital where she was working. She doesn't want to say which one.
One day it was particularly bad, where I had the same amount of patients I would have before COVID, but did total care for all the patients and didn't have the right PPE, and that's the day that I put my notice in.
Case numbers continue to rise.
This is a very serious situation.
What do you think now, looking back on what you knew then?
I feel like New Orleans kind of got the short end of the stick like we usually do. We were kind of flying blind and just sticking together and trying to find out what works and what doesn't. New Orleans really did work hard to get it under control.
P.
The nurses are concerned.
P.
Some shipments of PPE have been diverted.
E.
There's not a storeroom of PPE at these hospitals.
Personal protective equipment, masks, gowns, shields used to protect healthcare workers from infectious diseases. And not only did New Orleans not have enough, America did not have enough.
The nurses are concerned that they do not have enough PPE.
Are they getting sick?
Yes, some of them are getting sick. They're worried about getting sick.
Amy Devine got sick.
Oftentimes you don't even think about your own safety. And then a lot of other people with families were worried about going home at all. And some were renting rooms or hotel rooms or apartments because they didn't even know, could they give it to their family? Could my clothing, transmit the disease? Back then we really didn't know anything.
They're expected to care for patients that are contagious.
Praying every moment that I took care of this person.
Bree Anderson was a nurse at New Orleans East Hospital and died earlier this week.
It hit me like a ton of bricks.
Take some pictures and...
Abby McNamara is a respiratory therapist. She got sick too.
In the forefront of your mind, all you can think of is, oh my gosh, did I give this to my child? Coming home and you could possibly give it to your family. But luckily, I was changing in the garage. I was going straight to the shower.
I interviewed her after she was released from the hospital last year.
I have not left this bedroom since I got back from the hospital.
Her 4-year-old son Liam was locked out with his father for their own safety.
When he wakes up in the middle of the night and I hear him and he's saying, "Mommy, Mommy," and I can't go out there to go tuck him in. And if he's pulling on the door and I gotta lock the door at night because he wants to come and cuddle. It is so hard.
How can we expand the number of available beds?
Deadly virus.
It was really kind of scary because back then there was still not a lot known about it. It was Easter, so I remember I missed Easter.
This is Abby now. She and her husband are expecting another baby this summer.
We thought COVID was almost done, so we said it was a great time to have a baby and bring 2021 in.
She says she's grateful that at this point in the pandemic, her husband can be there for moments like this one, when they found out they're having another boy.
Maybe the little boy.
But the baby meant big changes for her at the hospital.
Currently, I'm not interacting with COVID patients or treating COVID patients since I'm pregnant, but I do help as much as I can on the outside.
It has been a year many healthcare workers won't soon forget. The highs.
Whenever somebody is getting better, it's literally high fives all around and smiles because you love seeing those success stories.
and the lows.
I just don't remember losing that many patients. An astronomical number. I mean, you would just hear code blue so many times in a day.
Many heroically battled an unknown disease, but the stolen humanity of it seemed to hit the hardest. Healthcare workers had to fill the void left by family members who were locked out.
I couldn't hold his hand. I couldn't kiss him.
Armed with phones and iPads.
I felt like it was like a human rights violation to have someone be dying in the hospital and not allowing visitors to see them. You just can't help but think of all the people that did die alone.
They watched as COVID patient after COVID patient died alone, being there when families couldn't.